So many times patients come to us with the belief that the only way that they could possibly get pregnant is through IVF. So for some couples, that is true. But for the majority of the couples, they don't necessarily need to go that deep into fertility treatments in order to have a baby. Patients are often surprised that they'll have 2 or 3 failed IVFs, they'll take a break, they'll work with us, the male factor and the female factor, and they'll get pregnant naturally. So there was even a study that was done a few years ago about Chinese herbal medicine when it's prescribed by an expert who knows Chinese medicine, so not just a random formula that people find. So it's specific to the pattern. Patients are twice as likely in a third of the time to get pregnant compared to IVF. So meaning they get pregnant twice as often, and on average it was about 4 months, whereas IVF was half as likely and it would take on average 12 months. That's another thing that patients get confused about. They think, okay, we haven't had a baby yet, so we'll just do IVF. I wish it were that simple. Unfortunately, some patients have had up to 10 IVFs to have 1 healthy baby. So it's getting better because the technology is getting better, so that's great. And the embryo quality and all of it is improving. So it really has changed in the past 20 years, which is wonderful. But patients are shocked that a lot of times they will come to us to prep them for IVF, which is wonderful. We love doing it, and we'll do 3 months prep, help them right during the transfer time. And then I always take them through the first trimester. It's the most vulnerable time, the most likely time to miscarry. And there are literally acupuncture points that prevent miscarriage and reduce what we call restless fetus syndrome in Chinese medicine. And so that's wonderful to add that to that. Then they often, after the baby can walk and talk and they're ready for baby number 2, they'll come back to us first and say, well, we're not sure if we have to do IVF yet, and we really don't want to if we don't have to. So we'll work together for a couple months. And I would say, without looking, I was like 9 times out of 10. Sometimes it's that high, sometimes it's not. It depends on the case. Everybody's so individualized. But oftentimes we're able to get them pregnant without IVF. So it's pretty amazing, the changes that you can see in your body. And I work with each patient and each couple individually. So depending on your age, we're only going to work on this naturally for so long. And depending on the complexity, and if you come in and you're not ovulating, and within 4 to 5 months you're still not ovulating, I'm going to be having some serious conversations about changing your treatment. I talk to my patients all the time about, are you open to IVF? Are you open to adoption? Are you open to foster parenting? Or do you just want to do naturally? I never recommend going longer than a year. Some of my patients don't listen to that advice. Some of them are just really see all these changes and their hormones are balancing and they're ovulating and they just want to keep trying a little longer. If they're young enough, I'll be supportive of that. But I feel like after a year of treating the female, and if we can treat that male partner as well, you've done everything you can. You're in the best place to start IVF. And I usually encourage them to look into that.